Good morning and welcome. I'm Dawn Kissi. I'm the founder and publisher of Emerging Market Media, a digital media firm based in New York. I'm also a board member of the Association of Foreign Press Correspondents in the United States, as well as a board member of the club. Today is next in our series, our educational series that we host, featuring experts for a global audience, as well as foreign press based in the United States and around the world. It is our pleasure, an absolute pleasure, to welcome Sonni Efron from the National Press Foundation, Glenn Cohen from Harvard University, Seema Mohapatra, Julian Sanchez, experts in their fields who will tackle the topic of vaccine passports, an issue that is top of mind as the global COVID-19 pandemic rages on across the world. Today, we are thrilled to have our corporate sponsor and partner Bayer here, as well as Sony, and we are grateful for the partnership and steadfast support from the National Press Foundation. I will now pass it to Sonni Efron, who will say a few words and kick off our panel. Sonni, good morning.
I think you might be muted, Sonni.
Sonni, please unmute. Thank you.
Here we go. Sorry. Good morning. I'm Sonni Efron with the National Press Foundation. I want to thank you, Dawn, for hosting this event and all the panelists. Very briefly, we have a partnership we value very much with the Foreign Correspondents Club. We are hoping that these programs will be of interest to journalists, not just in the United States and not just foreign correspondents, but also around the world. And I think given the salience of this topic, we're really delighted to have you. So I'll turn this over back to you and look forward to hearing from our experts this morning.
Absolutely. Thanks so much. And the feeling is mutual. I speak on behalf of myself and the board. Thank you. Okay, let's kick it off. Professor Glenn Cohen is one of the world's leading experts on the intersection of bioethics, also sometimes known as, quote, medical ethics, as well as health law. He also teaches civil procedure from Seoul to Krakow to Vancouver. Professor Cohen has spoken at medical, legal, and industry conferences around the world, and his work has been featured nationwide from PBS, CNN, MSNBC, National Public Radio, Mother Jones, the New York Times, and more. We're thrilled to have you here, and we look forward to you sharing your expertise today. Next, we have Julian Sanchez, who's currently a senior fellow at the Cato Institute, which is a think tank based in Washington, D.C. His expertise lies within civil liberties with a particular focus on national security and intelligence surveillance, which we know is also top of mind today, not just with journalists, but with the populace as a whole. And last but not least, Professor Seema Mohapatra, an expert in the areas of biotechnology, law, public health, and of course, reproductive justice, racial and health equity. She earned her JD from Northwestern University School of Law and her MPH in epidemiology from Yale University. We are thrilled to have you here today. Thank you all so much. So before we get into it, one question. What is a vaccine passport? Let's start from there.
Sure. Do you want me to take this?
Absolutely, and then we'll go around, we'll do a round robin.
Okay, sure. So when we talk about vaccine passports, it's kind of a misnomer, and I think that my co-panelists will agree, because there's really, when we're talking about passports, you think of, international travel. There's definitely a thought that some kind of vaccine credential could be used for international travel, but then there's lots of domestic programs that are also being called vaccine passports, which are really just, examples are like Israel's Green Pass, which was instituted and already phased out and now being thought of as being reinstituted. And in New York, the Excelsior Pass, which are really just proof of vaccination or proof of actually having had COVID-19 as a way to gain access to whether it's concerts or, workplaces, schools. And so there's a lot of different kinds of schemes that are all being under vaccine passports, but that's really, that's what I think of it as a way of proof of vaccination. So kind of like the old vaccine cards that we all had when we went to school.
And maybe I'll just jump in and say, completely agree with Professor Mohapatra. What I'll say is that I think actually there's two separate debates happening here. One is a debate about mandates. Should various kinds of institutions, sporting events, employers, universities, institutions of public life be allowed to require vaccination? And then the question is conditional on that being true, or maybe even if it's not true, just as a informational thing, what is the way in which we demonstrate whether one is vaccinated or not? And people often lump both together under the vaccine passport heading, but I tend to think of them as a question of the mandates, which are controversial and we can discuss, and a question about the proof. And amongst the proof, right, the most people, when they say vaccine passports, they have in mind a digital system that collects information and stores it on the cloud, as opposed to, for example, in the United States, the little white cards we have, which could be thought of as a kind of passport, show it, but I think most people have in mind something a little grander than that.
Thank you. And Julian? Please unmute.
I'll make it a trifecta and agree. Primarily, vaccine passports is a terrible bit of terminology. I think in large part because I think part of the backlash against the idea is linked to it. Look, a passport is a government-issued document that is verified at checkpoints by agents of the state when the state determines that you ought to be forced to present one as a kind of travel restriction. I think it would be more neutral and compatible with a variety of different models to just call them something like immunization credentials. Of course, in a sense, right, we already have bad immunization credentials. This is trivially easy to forge, but it is a way that currently people are using to demonstrate their vaccination status for a variety of purposes. So yeah, when we talk about vaccine passports or immunization credentials, I think usually what's referred to is some sort of upgrading of that to a more convenient and more secure form. So ideally, something that would in its print modalities be perhaps via a QR code, be cryptographically signed and verifiable, so you can check that yes, in fact, a recognized healthcare provider has cryptographically signed a string that contains the name and date and other very minor details to say, yeah, okay, this really was issued by an authorized entity, and then making it more convenient by saying, and also ideally there would be a version you can download to your phone, so you don't have to, carry a flimsy, deteriorating card around with you all the time.
Great, thank you for that. And I made note of something you said, quote, agents of the state. And you also held up your white CDC card, which is what Americans are being given when they get their first, second dose, or even their single shot J&J. Do you think that has become the equivalent of the yellow cards that the WHO issues? This is the Association of Foreign Correspondents. Many of our members and supporters have to meet certain thresholds, before they can even come into the country. Yellow fever, for example. As a correspondent, I've been in and out of so many different environments where they wanted to see something upon arrival. Are we headed that way? And I'd like to start with Seema and offer the floor to her to just give us more background, because as soon as you said agents of the state, I thought of my yellow card. And guess what? It's inserted in my passport, actually. Even if I'm going to France, no tropical diseases there, I always make sure I have it on me just in case. Are we headed down this road with these white CDC cards as Americans or no?
Yeah, so I'll kind of give an overview and then hopefully we can discuss that, because I think there's a lot of differences between the yellow card and COVID-19 vaccinations. First of which is that, yellow fever vaccinations have, been used for a long time. And this is, because of COVID-19 being a novel virus and the vaccination still in the United States just being authorized and not approved. But I wanted to kind of just give a, brief overview, and then I'll let my co-panelists kind of give more details. And thank you so much for having me here today with such an esteemed panel. And I'm a law professor who's been focused on many of the ethical and legal issues that the COVID-19 pandemic has brought up. And I've written a few articles about immunity passports and vaccine passports starting over a year ago when vaccinations for COVID-19 didn't even exist. I wrote some short pieces about this, as well as a longer, more recent paper in the American University Law Review called Passports of Privilege. And so that's the perspective that I'll be sharing. And it seems you really can't turn on the news without hearing about the latest about vaccine passports. So yesterday, the news was about Britain planning to ask for proof of vaccination for concerts and other crowded areas, and Israel perhaps reinstating its vaccine passport program due to rising cases. And so what I'd like to do is give you an overview of the topic. What are these passports? We kind of already covered that, but at a high level, I want to talk about what the controversy is, and I'll let my co-panelists expound on some of these issues. And so the concept of immunity passports were being floated back in April and May of 2020. And I wrote a piece at that time in The Conversation that was published in Salon and a lot of other outlets because of my concern that immunity passports would be both unethical and potentially legally problematic, especially in light of the inequities that the pandemic was already laying bare in terms of race, age, and disability. And so, as I mentioned, passports are generally a misnomer for these documents. It's really just proof of immunity, either via infection for immunity passports or proof of vaccination for vaccine passports, like old school immunization records for that all of us are kind of familiar with. Now, immunity passports were envisioned as digital passports that showed proof of past infection with COVID-19 for either international travel and or for entry into stores, workplaces in a time in 2020 when most places were locked down in spring and summer of 2020. Now, the concept of what a passport is in the context of the COVID-19 pandemic has shifted dramatically after vaccinations became available. Now, I will note that most of the world still does not have access to COVID-19 vaccination. So we're talking mostly about higher income countries in the global north, which, even if that have vaccinations, more readily available. And even then, not to all populations, especially those who are homebound or those with disabilities. And so since vaccinations were authorized, the conversation about vaccine passports has focused on just those that are for people that have been vaccinated, right? People that have been fully vaccinated for COVID-19. And the idea is to allow these pass holders certain privileges, like being able to travel internationally, go to restaurants and concerts, quote, get back to normal. Now, some have advocated for their use in more limited circumstances, such as workers that are exposed to vulnerable individuals, such as people working in long-term care facilities and hospitals. Now, Israel was the first country to roll out its vaccine passport or immunity passport concept, which was called the Green Pass. And they've already stopped using it as the perceived threat of COVID-19 lessened due to high levels of vaccination. However, as I mentioned, now that cases are on the rise, some are discussing reinstating these Green Pass restrictions. Now, how it worked in Israel was that vaccinated people could download an app that displayed their Green Pass when they were asked to show it. And the app could also display proof that someone had recovered from COVID-19. So it was not just for those that were fully vaccinated. Now, initially, Israel opened some businesses and services from pandemic lockdowns in February of 2021, but there were only some things only available to those that held the so-called Green Pass. So gyms, swimming pools, hotels, other cultural facilities initially were just open to those that were fully vaccinated and had the Green Pass. Now, about 55% of Israel's population has received the 2 recommended doses of the Pfizer-BioNTech vaccine, which was the quickest kind of vaccination inoculation pace per capita. But I have argued that these are still passports of privilege, as there are populations, within, such as Palestinians in the occupied territories, the West Bank and Gaza, that have not been vaccinated at similar rates. About 30% have received at least one dose, which is, quite a stark difference. And so when we talk about vaccine passports or vaccine credentials, sometimes governments are considering their use, whether it's for school reopening or other reasons, or international travel, or in the case of states like Florida that are banning their use for political reasons. Sometimes that's what we're talking about. And then sometimes we're talking about private entities such as businesses and airlines and cruise lines who would like their customers to feel safer and get back to flying, cruising, attending concerts and bars and the like. And, as I mentioned, New York had a version of this passport that they tried out called the Excelsior Pass, which showed proof of vaccination to attend certain venues. So at a high level, there's a lot of different camps about vaccine passports. And so some advocate for their use to get past the pandemic and return to normal and allow the economy to safely reopen. And then some believe that using a passport system would actually encourage people who have been actually hesitant or holding out on getting the vaccine to take the vaccine, because otherwise they'll miss out on the privileges given to those that are fully vaccinated. But there's been a lot of controversy as well about vaccine passports from kind of all over the political spectrum, both left and right. And so one critique is, in the United States in particular, we live in a tiered society where Black Americans, Indigenous people, Latino populations are bearing the brunt of this pandemic, and yet they have been getting vaccinated at much lower levels than other races. And we're seeing this countrywide, even as vaccine appointments go unfilled. And so in some of these minority populations, there's earned distrust of the medical establishment due to histories of experimentation and current mistreatment, not just histories. And so punishing people without earning trust seems unfair. And there's also this global unfairness of only certain countries moving on from the pandemic as others are ravaged by it. There's a whole host of ethical problems, like creating a two-tiered society of haves and have-nots that are affected by race, disability, and other markers of inequity. There's a concern that people have about fraud, and that when anything is policed, especially in the United States, we see that the consequences for people of color, especially Black Americans, are quite different than for white people. And so, the passports also could have a chilling effect on vaccinations for undocumented individuals, which is the opposite of what we want. We need more people, not less people vaccinated. Another critique is the practical use of vaccine passports in an age, particularly of breakthrough infections with the Delta variant. Are vaccine passports likely to give a false sense of security when really universal masking and other methods may be a more practical answer for safe spaces and safe reopening? There's also conservative critiques about how civil liberties would be squashed if vaccine passports are adopted. And I know we're going to talk about that with my co-panelists. And so, and also both sides are kind of worried about potential privacy breaches, which I also know will be addressed by the two other co-panelists. And I believe that Glenn will be focusing on the legal aspects of these passports, and as you heard, he'll be talking about whether mandates in general on passports and specifically in terms of their use for reopening. And so I'll kind of leave it here right now as an overview, and I'm happy to come back and talk about this more. Thank you.
Seema, that was fantastic. Thank you so much. You've touched on a lot. And Glenn, I'm going to give it to you in 30 seconds, but I just wanted to also to stress what you said about the inequalities. I'm based in New York City, and early on in the pandemic, there was talk about how the undocumented and the day workers, the laborers, the guys you see, they were actually afraid to seek care because they were scared that if they walked into that ER or walked into that community clinic, the feds would be looking for them. And that has come to the fore. It's been laid bare. The people that are moving this economy from the bottom, they were the most at risk. And I think that reality, it's always been there for Americans, but I think it's just come so close to them now. Because guess what? Your supermarket clerk isn't available anymore, And the legal ramifications of, okay, do we take care of naturalized US citizens or do we take care of quote unquote illegal immigrants? And I think a lot of that, as people that are moving through society, I think inequity runs rampant. Because I don't know who's illegal and who isn't, right? You can't just judge from looking at someone, quote unquote. And I think that's very interesting, the inequality that you touched on. And of course, the legal ramifications, Glenn. You know, I've heard friends say it, and even I may have been quoted as saying this, I don't have a right to kill you, right? So if I'm vaccinated and you're not, you know, I'm wearing my mask, like as the campaigns in New York City have said, I'm protecting you. I'm wearing my mask because I respect you, not to protect myself. Because I don't have the right to walk into a subway car, walk into a shoe store or a deli or a nail salon and kill someone. And if you're relatively healthy, according to the science, you can actually walk with this for weeks on end and just, you know, spread it everywhere you go. So Glenn, I'd like you to touch on that. And where do we get to that point where, okay, you're gonna carry this passport because I need to know, I don't wanna die.
Great, so a lot there. Let me actually start with your prior question about the yellow fever analogy. And my friends Françoise Baylis and Ellie Kofler have a great post on this in the Hastings Center report. And here what I would say is there's a Venn diagram in which this is some ways like the yellow fever, in some ways not, but it's instructive to take a moment to talk about that. In some ways, I think the better analogy is actually to smallpox at the turn of the century or turn of the last century in the United States, where in fact employers did have a show the scar campaign and required people to prove their smallpox vaccination as a condition to entering work because of the contagious nature here. The reason why yellow fever is not a perfect analogy is because the yellow fever vaccination is largely about protecting the traveler. But as you've just said, this is about protecting both the individual who's being vaccinated, but also the people who have been not being vaccinated, and also sharing information. Now, I do think, though, that one thing that is interesting about the yellow fever is to the extent your biggest concern is privacy, I think the yellow fever card shows us this is not really a privacy issue. It's not top secret information that you've had the yellow fever vaccination. It's not top secret information that you've had the COVID-19 vaccination. And the fact that we can require this to demonstrate, you know, and to have this in your passport, as you say, every time someone looks through your passport, not just in the regions that are high in yellow fever, I think is a good illustration that we should not kind of buy too much into this hype of the privacy. Now, I want to return to where I started, which is to say how important it is to distinguish the debate over the mandates and the debate over the passports. I think most people are actually upset about the mandates. They're not that upset about the passports, and the passports are just the way into this. So what's the argument for these mandates? What's these arguments for these passports? The passports in particular, I think there's two arguments. One that my libertarian friend might like, which is the argument that it is a least restrictive alternative compared to the possibility of having shutdown orders and the like, or restrictions on everyone. The vaccination passport regime allows us to reticulate the level of civil liberties restriction based on the real risk that individuals pose or do not pose. And here, I think actually the incidence of breakthrough infections in particular are actually a strong argument for these passport regimes, not against them. And let me just tell you why I think that. And that is because in a world where everybody has a white card and there is no central collection of this information, nobody knows what date people were vaccinated, what vaccine they get, and that's not centrally collected, it's much harder actually to have a sense of what's going on in terms of the general public when we start seeing infections, to learn about differential protection rates, durability of vaccination for different kinds of vaccines. So there's actually a strong argument for collecting this, and the United States is really, and this is true about all vaccination, incredibly behind the rest of the world. So that's one argument for them. The other one, and here I think libertarians may have a little bit of a harder time with this, is a more collectivist, and this is to goad people or nudge people into getting vaccinated not with like lotteries or penalties or something like that, but with a risk regulated access to the economy that is key to your vaccination state. And there's some evidence that this works, unclear in the United States because we don't have these mandates. But in France, for example, when Macron announced that we were going to do this, we saw a huge jump. I think it's somewhere like 2.2 million in registration. So there is some sense where if your goal is to get the entire population vaccinated, in order to be able to open it up, that this is a strong argument for doing so, but one not everybody in every political stripe will agree with. Okay, now let's talk about the law for a moment. And this is, again, more relevant to the mandates, but also the passports. There has been two things that people say a lot and have being litigated, and I think it's really important to get clarity on. The first is HIPAA, HIPAA, HIPAA. I joke that this is the 5-letter word, you know, a 4-letter word in healthcare, but a 5-letter word when it comes to health privacy. When somebody asks you to show proof of your vaccination status, there's no reason to think that that is a HIPAA violation. So if somebody says that, and that we can get into the details as to why about covered entities and what is protected, that's just a wrong turn. And when people say that, you should say, maybe not. The second argument, this one I think is more contestable territory, has to do with whether the fact, and this is the other distinction from the yellow fever that Professor Mohapatra made, the fact that this is under an emergency use authorization at the moment versus a full BLA approval, whether that ought to make a difference for mandating that this be required. And here again, notice we've stepped into the mandate debate. And here, what I'll say is there have been 2 lawsuits recently that I think have come out correctly. One, Houston Methodist, which required its employees to be vaccinated. The employees say you can't do that because it is an EUA, not a BLA, an emergency use authorization. And the court, I think, correctly said the statute, although it talks about informed consent, there's nothing in the statute that says you cannot condition it this way. And the way I prove this to people is I say, you know what? Many of you who've gone back to a workplace or a university in the last year, you had to do a COVID test, I'm sure, as a condition of coming onto the premise. Turns out those COVID tests are also, for the most part, authorized under EUAs. If it was really true that the mere fact that something is an EUA prohibits you from mandating it, then basically all the employers and universities across America had acted unlawfully. And that would be the implication of the view. I think that's wrong. I think it's wrong from the way the statute's written. You know, as we often say, Congress does not, you know, hide elephants in mouse holes, right? If Congress wanted to upset the entirety of employment law, you know, labor law, all of this stuff through the EUA statute, probably would have done so in a much more explicit sort of way, but we can have that debate. The other argument that's been made is that it's a constitutional violation to require this, and this was recently decided, I think actually yesterday, the University of Indiana case that was decided by a district court, the first one like this. The judge spent 101 pages. He's a Donald J. Trump appointee. It's a little long, the opinion, I would say, but the end result is to say, no, you have no constitutional right to attend a school that has a vaccine mandate by not requiring that and saying, I don't need to be mandated. The universities and the employers have, for the most part, offered 2 exemptions, one related to people who are medically contraindicated, that relates to disability. The other relates to religious exemptions. I have to say there's some interesting questions. The ADA requirement, I think, is probably well grounded in the law. Not as clear to me whether a private employer, as opposed to the state, could say no religious exemptions. That would be an interesting set of questions. We have some case law in public schools and the like. But for the most part, I think correctly as a political judgment and as an ethical judgment, the institutions have said, if you have a religious objection, a sincerely held religious objection, we will let you, you know, not be vaccinated, but we may put on additional requirements of you for your safety and the safety of others. Quite interestingly, Boston College has said because Pope Francis said that that vaccination is fine, it is rejecting all Catholic individuals who have applied for a religious exemption. And that's going to be very interesting to see what happens and whether that's legally challenged. Okay, last thing I'm going to say, and then I'm going to stop. The biggest objection to all of this, I think, is the one Professor Mohapatra correctly pointed out, which is the question about immunoprivilege. And we have this interesting history about this, especially in the American South, and inequality. Here, my view is the fact that we are talking about 3rd booster doses, we are sitting on a stockpile of doses, is reprehensible, terrible, and we should be doing everything we can, including perhaps intellectual property changes, to increase vaccination rates and vaccine sharing across the world. That being said, given the reality of where we stand, to me, this is a question about whether you are leveling up or leveling down, right? It is true, both domestically in the United States and across the world, there are pockets, and they are not accidental pockets. They are our most vulnerable, in some instances, who are not vaccinated. But the fact of the matter is, my own view is that that's not a strong argument for leveling down and imposing blanket prohibitions on everyone, which would, if that's the alternative. Instead, you know, and this is, you know, Larry Temkin has this famous example where he says, it is true in some ways in a world where half the world is blind, it would be better if all the world were blind. That is true, it would be more equal in some ways, but nobody thinks that's a good idea, right? There are things that we prefer to equality, and equality matters to some extent, but it's not the end all and be all. So I would prefer to concentrate on leveling up, but I'm a realist. I'm a lawyer by training, so I am cynical and pragmatic. I think it'll take a long time for the entire world to get vaccinated. And in that interim period, this strikes me as a necessary evil, but I'm looking forward to hearing what other people think.
Yeah. Thank you so much, Glenn. I mean, that was incredible. And it's funny, as you were talking, Macron did come to mind. And, you know, he knows his country, he knows his people. They want to go back to the opera. The French people want to sit at the cafes until 2 in the morning. They want to go to the Louvre. They want to do things. He's not throwing lotto tickets at them. He's basically saying, you'll be free, right? He's not offering them money. He's not offering them free tuition at a 4-year public college. He's not, you know, he's not dangling anything in front of them. He's basically saying, this is where we are as a nation. We want to get back here, so please. And I did see that stat, and I was so impressed. And look at Canada. Canada is actually now on its way to surpass us, right? They got their supply chain issues intact, and they're so confident at where they're headed that they're going to open the border soon for us, their ally. They shut us out, right? Because they had the long view. They saw what was going on down here. And around the world, you see this, you know, certain countries tackled it very differently. There was martial law in some countries. India, massive political rallies, and we saw the result. To some extent, everywhere this virus went unchecked, you saw a variant, right? The UK had this policy where you got one dose and you stretched it out because, oh, we want everyone to have one dose. But then you started seeing variants appear and spread even more quickly. Now we're facing Delta. There have been some breakthrough cases with fully vaccinated people. And to go back to what Seema touched on, immunity passports, right? Like, am I immune? A 38, 39-year-old woman that did 2 Pfizer doses in March and April of this year, will that be enough for me to go here? You know, like, what's going to determine your immunity after what period of time when these are still EUA, the FDA hasn't given it the full go ahead, and, you know, we're moving. We're living in a world of variants now. There's COVID-19, and then there's this. So I'm really interested in, I have some follow-up questions for you, but you've touched on amazing topics as well, but I want to give the floor now to Julian, and we'll circle back. Thank you so much.
So just to circle back to the initial prompt, I should just reassert that I mentioned agents of the state in the context of disapproving of vaccine passports as nomenclature, and you know, I think that's in part because we shouldn't think of this primarily in terms of you know, mandates and policy. That's going to be a component, of course. As you mentioned, Canada's opening up its border to vaccinated American tourists. Other countries are going to make this a travel requirement, regardless of what policy we employ. Probably for travel, you're going to, in many cases, require some kind of demonstration of immunization status, whether it's a shoddy one or something more sophisticated. But you know, we also have a kind of informal, emergent yellow card system for specific applications, not for, and I think this is what people are primarily worried about, right? Not the grocery store, not the corner bodega. It's really not worth their while to check everyone who walks through the door to make sure they've got a CDC card. But you see it everywhere. The yoga studio a couple blocks away from me has full capacity classes, masks optional for vaccinated people. Classes open to anyone that are lower capacity, masks optional, and then classes that are open to everyone, but masks are required and are a little higher capacity. A friend of mine this weekend just attended BlurredCon, the Black Nerd Con. It's a kind of sci-fi comics and fantasy convention that aims at the sort of the BIPOC fan community. And you had to show your CDC card to pick up your badge. That's not a mandate. That's not a policy of Arlington, Virginia. That's what the convention organizers thought that they wanted to require to make it safe. Now, could someone just forge one of these? Yeah, so you're effectively halfway on the honor system. You could Photoshop something and print it out, but it's a system that's already being employed in a situationally specific way. Even Fox News, Tucker Carlson, essentially has this, right? They have, if you are working on premises at Fox News, they have this sort of health check protocol you have to go through before you show up in the morning. But if you've established your immunization status, you can bypass that. So it's not a kind of hard line, right? It's a question of, and as with the yoga studio, what you have are private organizations that determine that given the details of their space, yoga studios and gyms, there's maybe a higher risk of transmission, people are sweating and breathing, they're going to develop, using the fact that credentials, bad though they maybe exist, a system that they think adapts given the needs of their space to their safety needs. Cruise ships are another case, right? Again, I think the grocery store is probably not going to ask for your immunization credential unless a state requires it. But a cruise ship where, they have probably 1 or 2 physicians and a handful of RNs and a small infirmary and 1,000 people on board who the cruise is over if you have an outbreak, they have very strong reasons to be fighting with Ron DeSantis about whether they want to make this a requirement to get on board. And that's one reason I suppose I'm less concerned about some of these equity issues. I mean, yes, it's true that if cruises require this, the very poor may face barriers to going on cruises. But I don't know how much of how much worse than the status quo that makes things. I think what people are concerned about reasonably is this going to be so widely demanded that you are effectively excluded from economic participation if you have not been able to or have some idiosyncratic reason not to be able to be vaccinated. And I think what is more likely is you're going to have gyms and yoga classes and conventions and cruise lines are going to decide that they have a reason to ask for this check, for this to be demonstrated, whether by the shoddy means or a more sophisticated one, and that whenever possible, it's not going to be a kind of hard yes. For the cruise line, it may be you got to be vaccinated to get on board, and your alternative is don't take the cruise. But I think more frequently you're going to see something like the yoga studio where they are not eager to turn down paying customers. Jobs are not eager to fire otherwise productive employees as a rule. And so I think it's going to be a question of, if you provide a way to verify status, will organizations and entities where either as a matter of sort of the community's preference or the specific risks of the space, are they going to find a way to adapt in a way that uses that information to improve everyone's safety and level of comfort?
Great, thank you so much. And I will add that when I was given my white card, I was told not to laminate it just in case. I remember unprovoked, that's what I was told.
In case of what?
The first thing that came to my mind was like, okay, I got to photocopy it, have a backup somewhere. But even before I could open my mouth and get out of that chair, I was told not to laminate it. So to me, that's a sign of what's potentially to come. We just don't know. There are too many unknowns. And I just want to cite an example. I think it was no more than 2 weeks ago, the mayor-elect, Eric Adams of New York City, he was asked they were talking about the virus. And he basically said, we got to be smart. He wears a mask indoors regardless, because for him, it's psychological. It's what he needs to be comfortable. Even if everyone in the room is vaccinated, Eric Adams is keeping his mask on. And he was down in Washington meeting with Biden, and I was watching the live shot. And I thought that was really interesting because he was telling people, okay, the mandate may be lifted, but please be smart. I'm keeping my mask on. And you should do the same. Don't feel pressured to take it off all of a sudden because the mandate has lifted. And when he spoke about his comfort zone, I thought that was very interesting, again, because I don't have a right to get someone sick. I could have the virus right now and not know. I don't, but I thought that was one interesting take on it. Rather than walk around with his vaccination card, he's just keeping his mask on, right? How many Americans can we trust to move forward with that train of thought? I don't know. I don't want to speculate because liberty, freedom, rights. And then you start getting into very tricky waters where kids are back in classrooms, right? And teachers, professors may not feel comfortable in the lecture hall with 50 students. International students who are coming from countries where the vaccine rollout has been shoddy or even non-existent. They're here now. Are their immunity levels up? Okay, they got their dose when they landed, but where are they? And there are a lot of issues to play. And again, it circles back to equality, ethics, health law. and more. So Glenn, I'd like you to counterpoint what Julian came out with. I think you have some thoughts there, or correct me.
Yeah, not so much a counterpoint, because I agree with a lot what my learned friend said. I think, but here's the one thing that I'll emphasize that worries me a little bit. In the United States, as opposed to other countries, we haven't had, and this is in part because unfortunately this issue has become a right-left issue. It shouldn't be. To me, it's the politicization of, we've gone through a rough period of politicization in this country, so it was probably close to inevitable. But what worries me is the choice between a fragmented system versus a kind of universal highway. And here's what I often say is I wish Joe Biden would build the highway, even if he doesn't plan to enforce or set the rules of the road. And the reason is because in a world without a federal vaccine passport, digital health pass, I guess is the term I prefer, system, you're going to see the fragmentation. You're going to see some people asking to see the white cards. You're going to see New York roll out Excelsior. You're going to see this employer roll out this. You're going to see the New York Sports Club roll out its version of this. And as a result, you have multiple people having this information. As I've said, I don't think this is top secret information, but to the extent people do have privacy concerns, first of all, it's a hassle to upload it 5 million times, but it also means more data is being collected in more hands. Now, I'm a little wary about saying, well, the federal government, they're great on IT stuff, right? We think about healthcare.gov and its original launch. But in some ways, I would rather there be a single system that is well designed, easy to use, easy to share credentials when you want to, and has good cybersecurity than to have 100 of these systems and have everybody sharing partial information part. It's also better to do it this way for disease surveillance purposes, to be able to say when there is an outbreak, for example, can we know the date and the type of vaccine that every single person in a community had? And when I look across the world, right, I look at Denmark, I look at France, I look at all these other places, they have kind of built the highway. They're also enforcing the rules of the road. It's a little bit different here. I think that would be too much to ask of the federal government in the United States, to be perfectly honest. But I do get worried that we haven't had a leadership from the federal government on this. And I think it's a little bit of a hot potato, and it's a little bit of not wanting to touch it with a 10-foot pole, but I think we're the worst for it.
Yeah, the argument there is states' liberties, states' rights, right? Then next thing you know, it's not the state. It's coming down to the municipal and local level, and then it gets complicated and expensive. And it's just, it's a very heavy issue. I'm a New Yorker. I have my Excelsior pass. I haven't had to show it anywhere I go. But let's say I want to go to a Knicks game, I know I can get in now. But then what does this expose? The digital divide, right? How many people, we live in a society where a lot of people in America are still not connected. Broadband is an issue. Digital services are an issue. There are people that have mobile phones that don't have certain services on them. Can everyone download this Excelsior pass and have it running? Can everyone afford even 5G? We don't know that. We don't know that. So that's another issue that circles back to inequality. And Seema, I'd like to hear from you on that.
Yeah, so the digital divide, I'm glad you brought that up. That's definitely an issue that we've seen just in other aspects of this pandemic, even schooling and online schooling, and the families that were kind of policed for truancy because they couldn't get on. We have seen with statistics that the digital divide in this country is very much based on race as well. And so with different pockets, but people of color having less access to that technology in general. And I worry, when you said that you haven't been asked for it, for the Excelsior pass. That's one concern about the passes. And I've written about this in the context of mask mandates, is who is being policed and who is being asked for their proof of whether it's, vaccination, whether it's, social distancing requirements. In New York, we did see that for social distancing violations, we saw that it was very much more the percentage of African Americans and Latinos that were being policed, and that had, even though you were not supposed to be arrested in terms of citations or being, picked up. There was a lot written about that last summer. And so, I think that I agree, in terms of Glenn's point about the fact that we are lacking a national infrastructure and a healthcare infrastructure. I completely agree. But compared to those other countries, we also don't have the same kind of unified plan. We do not have any kind of universal healthcare. And I think there is a concern about once there, even though it would be nice to have a repository of this kind of information, even for public health epidemiological reasons, as you mentioned, I do think that the government, we need to do a lot better job of earning the trust of communities. And, that can come, it's not these high-flying ideas. It's just from representation of people in different communities on the state committees that are making their vaccine plans or making the different public health plans. Just having buy-in from different communities and getting those perspectives, I think we've been lacking that, even though we've known that's an issue during this pandemic in general. And so, in terms of the equity issues of vaccinations, the conversation is kind of stopped on that because now we have vaccinations available, but there's still people that cannot access either because the vaccinations are not coming to their work and they can't take that time off work, people that are hourly workers, people that are concerned about if there's some kind of database because of worries about immigration, people that are homebound. And so I think we need to address this. And it's not an either or. Colleen Flood and a co-author has, written in JAMA about kind of equitable vaccine passports. And at the same time as having, some kind of, as Glenn put it, we don't want to, necessarily say all of these are bad just to kind of move on just because there are people that are not able to access it. But what I am worried, and I agree with that article, but what I am worried about is that we are going to leave people behind. And so I think having the priorities be to make sure that we're getting everybody vaccinated, but and I'm not against mandates at all. I just think that we need to make sure that this conversation isn't just moving on and not worried about both national and global equity.
Yes, thank you so much. Okay, we are down to our last 10 minutes. I'm going to open the floor up for questions. There are many questions coming in. I'm going to start with Sonni Efron, who had her hand up very patiently. Sonni?
Well, hi. I have two big questions. One is for Glenn Cohen, and the other learned people might want to comment. Having back to the Indiana case that you mentioned, I'd like to take advantage of having three crack lawyers here to talk about the implications. First, I thought this was a landmark case. Do you expect this to be, modeled again in copycat, lawsuits in many other states? Do you expect employers then to seize on the university model as a way to say, okay, conservative judge in Indiana says we can do it if it's the reddest of the red states. So doesn't this imply that we could have legislation like this all over the country? Do you expect it to go to the Supreme Court? So that's the first one. Then I've got a separate question about the yoga studio model for Mr. Sanchez. Thank you.
So I'll start and just say, I don't think employers are really worried about the legality, to be perfectly honest. I actually don't think there are a lot of hard questions in what I do. I don't think these are one of them, to be honest. I think instead it is about pushback. It is about not being kind of out front. It is about, especially in tight labor markets, losing people. I mean, in Houston, the Methodists, they won the case and they lost 150 employees, right? So I don't particularly, I think this will give a little more confidence to people on the fence. I'll also say, so the Indiana case, what was relevant is that it's a state university such that the Constitution was implicated. For most employers, the more relevant question will actually be the statutory question of the emergency use authorization statute. And here, I think the Houston Methodist case is more significant, although much shorter, right? The Houston Methodist decision basically devotes like all of 2 or 3 paragraphs to the issue, which made me happy because that's kind of what I said. But I think also that my guess is that we'll see a little bit more litigation to it. I think the one place where the Supreme Court might get involved is if we have institutions that do not permit religious exemptions, especially state institutions. thus far, everyone I've seen who's doing it has been allowing a religious exemption. So I think either cautiously or because they think it's the right thing to do. So for that reason, I think the states may not be, the Supreme Court might not get involved. But if they didn't give that exemption, and we have case law suggesting that for public health, public school vaccination, actually a religious exemption is not constitutionally required. But I could imagine with the newly constituted Supreme Court that might be something that could be revisited. So that would be my prediction.
Thank you.
Next question.
Well, my question for Mr. Sanchez has to do with the yoga studio, the fascinating yoga studio example you just gave. So we've talked a lot about equity. I'd like to talk about freedom of association. Specifically, I don't know if this is a conservative libertarian question or not, but freedom of association implies the right, presumably, not to associate with people that you don't want to associate with. Now, in the yoga studio case that you just mentioned, presumably you've got the right to select which class you want. But in many aspects of public life, and I'm focusing back to schools and what you just said about the school issue, you don't get to choose, you don't get to find out who else is in your child's class. So do parents on behalf of their children have a right to freedom of association to decide who their children should and should not associate with in a public place or in a private place? A very complicated legal issue, but I'd love to hear all of your views on that.
Yeah, Mr. Right. So schools obviously have a separate category. We're talking primarily about public institutions, where indeed, for a long time we've had vaccine requirements with a series of exemptions that vary by state. And I think the reasonable thing to say there is, well, we should think about this more or less the same way we do about other in a sense that's not really a kind of a passport question, because we've done verification of status in schools, for a long time without having any kind of fancy digital mechanism for verification. So I think in a sense, that's a distinct question from the passport question. This sort of circles back to, I think, what Glenn said at the very outset, which is this is understandably very much entangled with the question of mandates. Where should these things be required? And I think, in a sense, the limited question about passports itself is pretty easy. I think if you disentangle them to some extent and say, look, should the records that we have be reasonably robust authentication mechanisms, or should they be trivially forgeable to the extent they're going to be used for anything? I don't know, a lot of people say, no, they need to be trivially forgeable. It's really important that the records that we're already distributing be easy to forge. But yeah, in the context of schools, I wouldn't think of that as a free association question, because there we really are having a public institution that, to some extent, parents have who are paying tax supported have a kind of right to access within limits. And so I don't think of that as much through a free association lens in the same way I would with, a yoga studio, a gym, a comic book convention, where the organizers can say, here are the rules we wish to set for this private group we're organizing. If you like those rules, welcome in. If you don't like those rules, maybe you will find another place down the street that has rules you find more congenial.
Julian, thank you so much. Okay, there's a question from an audience member, and I'll open it up to all of you. So how far is too far? Let's say vaccine passports do become our new reality. How is it forever? Or is it until, for example, the WHO declares this pandemic over? When does it end, if it ever ends? And I'd like to put that out there. This is actually a very interesting question.
So, I mean, I'd actually suggest that in a way, the best case presently for building this infrastructure is for future cases. That is, we're getting by more or less at the moment with pretty minimal checking for most scenarios. If a year or two from now we have it sounds like a Robert Ludlum title, we have the Omega variant that is not very well dealt with by Moderna, but does you do get immunity from Pfizer if it's in the past year or you get a booster, and you now face a choice again between renewed lockdowns or more aggressive differentiation between vaccinated and unvaccinated, or recently vaccinated, or which version you got. We'll be very happy to have the infrastructure in place that will enable that to be the alternative to everything shuts down for a year again. And thinking a little bit more prospectively, maybe not just the Omega variant, but the next one of these. This is not going to be the last pandemic we encounter, and I think avoiding another lost year may well depend on having a flexible infrastructure that can be rapidly deployed to allow more sophisticated and flexible responses.
Okay. Julian, before I get to the next question, I just want to touch on what you said as a lost year. That could mean different things for different people. Some people got incredibly wealthy during the past year, others did not. This year of isolation has meant a lot of different things to a lot of different people, from elementary school kids to grandparents, to different people moving in society. I don't think it was lost. I think it was almost a sort of awakening, because I think Americans, well, at least in this country, we needed this reckoning, right? We needed to see things. We didn't need the deaths. We didn't need more than 500,000 dead, but we needed certain things to just rejigger, because now look what's happening. There's a worker shortage. I never thought I would hear that in the US. People don't want to go to work. Apparently, job candidates have the upper hand because they're basically saying, I'm going to be remote 2 days a week, or I'm not doing this job at all. I never thought the business cycle in the US would come to where it is today, but there have some people that have capitalized, seized opportunities, and whose businesses came to the forefront. I mean, you couldn't find a container of Clorox wipes in New York in some neighborhoods for months last year. Who thought the supply chain would break down to the point where $6.99 Clorox wipes are being sold on the street for $30? Because we didn't have them. So I think it wasn't lost for some corporations and for some large entities, but I get what you're saying, but I just wanted to put that out there. We've got another question, and I'll get to Sony's last question for Seema. Someone is asking, how uniform should it be, right? So I don't have all the details of this question, but inequality in Greenwich, Connecticut is not inequality in Mobile, Alabama. How do we bridge that divide? How do we make sure that a rural community in Alabama is getting the same attention as in Greenwich, Connecticut, without infringing on their rights? And Glenn, feel free to jump in. Anyone on the East Coast that knows. Thank you.
I think I'll defer to Seema because she's done a lot more work on vulnerable populations and thinking about this. The only thing I'll just say is that one of the nice things about the highway and building the highway is that it can be used differently in different places. Just as we have different speed limits in different places, we can have different ways of using the same system.
We can get on and off it, right?
Yeah, and I'll just jump in and just say that in terms of public health, as a public health lawyer, and public health has always been local. I mean, that's how it's always been perceived in terms of both for laws and for, just the way that health policy works. And so it's really important to, the problems that a certain community is having would not be the same everywhere. And so it's really important to be responsive to each community. And so when I'm talking about a community, I'm not even talking about community like at a national level, although we do kind of, need some national guidance, but I'm talking about from a local, state, even locality level. And we've seen that, like, when we had the vaccinations roll out, we saw certain communities like in DC, Dallas, tried to address the inequities in those communities by, how they're going to roll out their vaccines. And then in some cases, like in Texas, we saw that there was pushback from the state saying they're not going to send vaccines if you're going to prioritize people of color. That's what Dallas was going to do. And so there's really, I think that public health and healthcare in general is local. I will add to what Glenn said in terms of the infrastructure. I think there are people that are worried that once the infrastructure is there, what else it will be used for, right? The genie's out of the bottle and we've given up the privacy because we're in a pandemic. And what else does that mean? And I'm not really a conspiracy theorist, but that is a concern that has been brought up.
No, a big concern. Last question, Sony, and it's directed for you, Seema. It's about big data and performance. Please unmute.
I'm so sorry. The question is data permanence. Back to both Glenn's comment about the highway off-ramp and yours. So assuming that since we see that vaccine passports are here in various forms, should there be a statute of limitations after which and should it be set statutorily after which the data disappears, particularly for minors? This data is in perpetuity, and we understand that in some cases, data is more valuable than gold, we're told. Should there be a legally mandated delete date on any vaccine data that's collected by a state or the federal government?
I will defer to the expert on this, Glenn Cohen. So I will defer to him on this.
I mean, I think this goes back to a little bit of a question of what Julian was saying also about the permanence of these systems, right? So it seems to me that the level that we retain this out, first of all, I think perhaps a right to withdraw the data, even forgetting about how long we keep it, might be good. But in terms of the retention of the information, it seems to me that it ought to be keyed to the length of the vaccination period. So if we learn that the durability is 8 years, I'd be hopeful, but let's just say it's 8 years. It does seem to me that at 9 years after your first vaccination, it would make sense to wipe the data because there's no thing useful that we're getting from the data. But maybe we should allow people to withdraw before that. But I do think thinking ahead to having some metrics as to when automatic deletion will occur would be a good thing. It would also be an olive branch to people who are concerned about the privacy implications.
I would say, better than automatic deletion is not collecting. There's no reason this needs to be done in a centralized way, right? You can have the only part that really needs to be centralized is probably the federal government needs to define a protocol and say, look, you are now contractually obligated to disseminate these things. Here is the protocol for the QR code that you're now required to put on the upgraded card that you have to disseminate. And we're going to maintain a database of the public cryptographic keys assigned to healthcare providers who have received vaccine allotments. Other than that, it can be the local health care provider keeps the records that they already keep about who they've administered the vaccines to, subject to whatever the local rules for doing that are, and they keep that data as long as they would or wouldn't based on state or local rules. And then the federal government has determined a mechanism by which you can scan this card and verify that the vaccine information was cryptographically signed by a private key corresponding to the public key of a known licensed vaccine disseminator. The federal government doesn't need anyone's, and no state government, unless they're the distributor of the vaccine, needs to collect your vaccine information. And I don't think the system should be designed that way. It should be designed in a maximally decentralized way where we don't need to decide how long the federal government is keeping your vaccine data because they never need to have it.
Great, thank you so much. On that note, I am thanking you all, Glenn, Seema, Julian, and of course, Sony. This has been incredible. It's not just educational, it's potentially life-saving, right? We're super grateful to have all of you here today on behalf of the National Press Foundation, the Association for Foreign Correspondents, the board, the club, the membership, and of course, Bayer. We are grateful and very much appreciative, and we will all thank you in unison. Thank you so much. And I'm looking forward to staying in touch with all of you. Please feel free to be in touch. And as more questions come from the audience, I will send them your way if appropriate.